Most people think condoms fully protect them from all STDs. They're wrong. When it comes to one of the most common infections in Malaysia, condoms only do half the job. Let me explain why. I am talking about HPV, or Human Papilloma Virus. It is so common that up to 80% of us will get it at some point, often without even knowing it. By the end of this video, you will know exactly what signs to look for. So let me explain what's actually going on. HPV isn't just one virus. There are over 200 different types. Unlike some STDs that spread through fluids, HPV spreads simply through skin-to-skin contact during sexual activity. The virus can lie dormant in your skin cells for years before showing any signs. We generally divide HPV into two categories: low risk and high risk. High-risk strains, specifically types 16 and 18, can cause changes in your cells that may lead to cancers over time. Low-risk strains, like types 6 and 11, do not cause cancer, but they are the primary culprits behind genital warts. Let's talk about the high-risk strains first. In Malaysia, cervical cancer is the second most common cancer affecting women. This is why the Ministry of Health strongly recommends regular pap smears for all sexually active women between 20 and 65 years old. It helps us catch cell changes early, long before they turn into cancer. Now, what about the low-risk strains? These cause genital warts, which might appear as small, flush-colored bumps. Sometimes they cluster together to look a bit like tiny cauliflowers. They usually grow in the moist areas of the genital region. While they are mostly painless, they can sometimes cause itchiness, irritation, or bleeding.
Beyond the physical symptoms, what most people don't realize is the heavy psychological burden. Having genital warts can make you feel anxious, embarrassed, and affect your sexual confidence. I see this a lot in the clinic, but please do not worry. You're not alone, and it is highly treatable.
Remember when I said condoms don't offer 100% protection? Here is why. Condoms are crucial, but they only protect the skin they cover. Because HPV spreads through skin-to-skin contact, the virus can still be transmitted if your partner has warts on the surrounding uncovered skin. Here is an interesting fact. 90% of HPV infections actually clear up on their own within 2 years. Think of your immune system like a security team. But if your immunity is weakened by things like chronic stress, poorly controlled diabetes, or smoking, the virus can take hold and multiply, leading to persistent warts. If you do develop warts, we have several ways to treat them. At the clinic, we might use special acid solutions, immune-boosting prescription creams like imiquimod, or minor procedures like freezing them off or using a laser. The goal is to safely remove the visible warts, though it takes patience. One crucial piece of advice I always give my patients: if you have an active wart outbreak, stop shaving or waxing that area immediately. These hair removal methods create tiny micro tears in your sensitive skin, which easily spreads the virus to nearby areas, causing new warts to form. To prevent the warts from coming back, you need to support your immune system. This means quitting smoking, getting enough sleep, and keeping chronic conditions in check. For our Malaysian patients with diabetes, keeping your blood sugar well controlled is absolutely vital to help your body fight off this virus permanently.
The single most effective prevention tool we have is the HPV vaccine. It protects against 9 major strains, including the ones that cause most cancers and genital warts. While it is best given before someone becomes sexually active, it is actually recommended and highly beneficial for adults up to the age of 45.
And here is a major misconception. HPV is not just a woman's problem.
the virus affects men too, causing a significant percentage of anal, penile, and throat cancers. Furthermore, men do not develop natural immunity to HPV as well as women do. That is why we highly recommend vaccination for boys and men as well.
So when should you see a doctor? If you notice any unusual bumps, experience abnormal bleeding after intimacy, or have unexplained pain in your lower abdomen, do not try to self-diagnose. Come in for a proper checkup. The earlier we identify the issue, the easier it is to manage and give you peace of mind. If you're worried about HPV, need a pap smear, or want to discuss vaccination, come visit our doctors at Klinik Temasya. This video is for educational purposes only. Please consult your doctor or visit your nearest clinic for personalized medical advice. If you have questions, leave them in the comments, and check out our video on STD screenings next.